Hi, I'm Dr. Brandy Matthews, currently serving as a Vice President of Medical Affairs for Neuroscience at Eli Lilly. The excessive buildup of amyloid plaques in the brain can lead to memory and thinking issues that are associated with Alzheimer's disease. And Donanemab is an IgG1 monoclonal antibody that targets these deposited amyloid plaques in the brain and can lead to plaque removal through a microglial-mediated phagocytosis. This removal of the excessive buildup of amyloid plaques can then slow the decline of Alzheimer's disease that may diminish people's ability to remember new information or appointments and dates, maybe to plan and organize and other activities in their day to day. Donanemab is marketed as Kisunla, and it's indicated for the treatment of mild cognitive impairment or mild dementia that's due to Alzheimer's disease in patients who have evidence of Alzheimer's disease pathology. Sure. So the most recent data that we presented from the Trailblazer-ALZ 2 phase 3 clinical trial is actually related to its long-term extension. So at the recent Alzheimer's disease, Parkinson's disease conference in Copenhagen, we were specifically focusing on long-term amyloid PET outcomes from that study. This includes 3-year amyloid plaque trajectories as well as exposure response modeling that uses data for patients who've been off treatment for an extended period of time. This allowed us to analyze the durability of amyloid reduction over time, as well as reaccumulation after treatment had been completed for many of the participants. So this data showed that participants who met their treatment completion criteria at 52 weeks had robust amyloid lowering, and most of them maintained those lower levels below 24.1 centiloids, which is a quantitative threshold that's consistent with a visually negative amyloid PET scan. So it looks clear on the amyloid PET scan at that level quantitatively. In addition, the inclusion of this data from the long-term extension confirmed that there's slow amyloid reaccumulation in treated participants, about 2.4 centiloids per year reaccumulation rate, which is consistent with the natural history of amyloid accumulation in older individuals. So more than 75% of the participants in the Trailblazer-ALZ 2 long-term extension achieved amyloid levels that were the low levels consistent with this visually negative amyloid PET scan, or less than 24.1 centiloids by 76 weeks. And most of these patients maintained those reduced levels for up to 3 years, which reinforces that many patients can complete their donanemab therapy at 76 weeks or even earlier and maintain their amyloid reduction without the need for ongoing treatment. Well, so Kisunla is the only amyloid targeting therapy that has dosing that allows patients to complete their course of treatment once the amyloid plaques are reduced to these minimal levels on an amyloid PET scan. So these data reinforce the potential of that differentiated experience for therapy. Okay. So I have very high hopes for the future, but have been a little discouraged that patients continue to experience real barriers to diagnosis and initiation of therapy. As the science has evolved, the clinical care pathway hasn't necessarily kept pace. So patients are challenged to have their symptoms detected in the primary care environment, and when they are detected, challenged to be referred in a timely manner to a specialist for more accurate diagnosis. Even once they make it to the specialist, sometimes there are limitations in their access to diagnostics, and we know that a timely and accurate diagnosis is critical to ensure that appropriate patients have access to these new therapies because they are approved for initiation in the early symptomatic stages of disease. So really important that we continue to break down those barriers. Something that I think in the future could help break down those barriers is increasing access to Alzheimer's disease blood tests. So we see that these are increasingly scalable and potentially high quality tools. So I can envision a future when a simple blood sample could be collected even in a rural environment and sent to a reference lab alongside a cognitive assessment. Then a patient could be rendered a timely and accurate diagnosis without the need for these additional delays. I think that could be really impactful for patients. So I think that's my real hope for the future is that we continue to accelerate access to timely and accurate diagnosis. Yeah, and I think we understand that this is going to require uh, not only industry but academia and policymakers and governments to come together to ensure that this science is advanced into clinical practice.